My name is Mario, and I've been a clinical research associate, or CRA, for over 10 years. I put out a video on the interview process. I broke it into two parts, general interview questions and oncology-specific interview questions. If you're interviewing for a CRA position, I'd recommend checking both those videos out. In this video, I just want to talk briefly about the pros and cons of a CRA job. And before I get into the pros and cons, I do want to say I am really referring to what's called a field monitoring job, one where you actually travel and go out to sites and do that on a routine basis. There is another CRA job, often called an in-house CRA, and that is where you would go into an office and deal with things like vendor management and other more project management-oriented tasks. Most of my experience has been as a field monitor. The first position I took on was a hybrid, so I did 50% of the time work of an in-house CRA and 50% of the time work as a field monitor. So the first pro to the CRA job and the field monitoring job, I would say, is the ability to learn about the clinical trial process. If you're interested in learning about how drugs get to market, and the different phases of trials and how to work on different types of trials, this is definitely a field where you will learn a lot. And I have a background as a study coordinator, so I was familiar with how things work from a hospital perspective, and then moved over into being a monitor. And the experience that I've had over the years has included phase 1, 2, and 3. I've actually not worked in a phase 4 study, but I do have extensive phase 1 through 3 experience, and a few of the drugs I've worked on have made it all the way to FDA approval, which is exciting. You go from getting a drug and working on a phase 3 trial to FDA approval. I've also worked on drugs that have failed in different trials, but like I said, one of the advantages of this job is you get a pretty good understanding of the clinical trial process. The other thing that is beneficial is you get to learn about disease areas that you're interested in. So my academic background was a little more focused in neuroscience and learning about neurological areas, but since I came into the work world, I've been working in oncology. 95% of my experience is in oncology. So I would say in the areas of oncology that I've worked, which include lung cancer and prostate cancer, leukemia, I know a lot about these areas and I know it well. Things like what's the standard of care, what are the type of challenges and side effects that patients may face, what are the current drugs that are upcoming for these kind of diseases. This is all stuff that you will be exposed to as a CRA. CRAs, it's sort of varied among CRAs how much they would know about the disease area, but hopefully if it's a disease area that you are a CRA and assigned to, you would want to make sure that you absolutely are familiar with the disease. And unfortunately, on occasion, you do end up with CRAs out there that don't know as much as they should. And this is pretty telling, usually at what's called a site initiation visit, where a CRA will present a study and then be asked questions by the PI about the disease. And some CRAs out there do struggle. So you definitely want to know your disease area well. The other advantages, if you don't like to regularly work in an office on a fixed schedule, CRAs do have some ability to adjust their schedule to be on site certain days or not to be on site certain days, or generally there's a little bit of flexibility. That said, it's still a high travel position, and there is a lot of work to do usually. So there's flexibility, but it's not the same as what a lot of people I know who say that they work from home experience. Yeah, most CRAs are home based, but they're in their home office maybe one work day a week, maybe two at most. So The cons of the CRA and the field monitoring job. I think the biggest con is the constant travel. Now, you'll get a mixed response here. I have enjoyed some of the travel, but I will agree that at a certain point it can be a little bit overwhelming. So almost for 10 plus years, my schedule has included going to the airport every Monday for the most part, and then returning back home every Thursday evening. So on a routine week, I would spend Monday morning prepping for whatever I needed to do at the site. So read the prior monitoring visit report, look in EDC, look for reg documents that might be outstanding. After I finished my prep work, I usually tried to book a flight that was leaving late afternoon, early evening. So that way, once I finished my prep work, I could usually get lunch and then head out to the airport and go wherever I needed to go. As I've become more experienced, my travel has been a little more regionalized. In the initial stages, I was a nationwide CRA, so I was sent everywhere. The regional model is a little less taxing, although I have been going up and down the East Coast. So from where I live in Florida to New York was a routine trip I would take, for example. So there is still travel and a lot of it. So once a Monday, which was my prep day and my travel day, Tuesday, Wednesday, and Thursday were my on-site days, generally speaking, where I would be getting to the hospital whatever time they let monitors get to the hospital. The hospitals vary in their policies. Usually it'll be something close to 9 to 5. But that's not the case across the board. So some sites will say 8 to 4, whatever the hospital tells you, that those are your work hours for those Tuesday, Wednesday, Thursday. Thursday night, I'd usually fly back after I'm done with the monitoring visit on that day, and then on Friday, usually I try to sleep in because I'd get in at midnight or some late time into the airport here in Tampa. And then Friday, I would try to do things like write the monitoring visit report, make sure that anything that needed to be done urgently is attended to. So those would be what I do, and the way I have generally worked out, I then take Saturday off, and then Sunday I'll do things like my expense report from the week, my timesheet. Some CROs vary. Some of them ask that you get your timesheet in by Friday. If that's the case, then I would be working on it to make sure that I did it on Friday. Most of my most recent experience has been with Monday. I think it was Monday by 10 a.m. was the due date. So I would spend Sunday usually doing my laundry, packing my bag for the next week, and doing my timesheet and expenses. And that was generally how I structured my week. And obviously doing this in and out all the time, all year round, at some point does get exhausting. And the con would be you never know where you're going. So it's not always the most exciting cities that you're headed to. It's not you could end up anywhere. You could end up in the middle of nowhere in Alabama, or you could end up, as I have in the past, in the middle of nowhere in Kansas. So you don't know where you're going. You don't know what the weather is going to be. So oftentimes I would go from an 80-degree day here in Florida to a negative 10 degrees day in Syracuse, New York. So that is also not uncommon. I think one of the pros I should mention to wrap up here on the travel is if you do like extensive travel and if you want to see places, this job is great. You're basically given money to go see places and do work. So as far as just expanding the amount of places you've seen, I have gone to over 40 states in the US, plus I've also monitored in Canada. So I've basically enjoyed being able to see a lot of different places. So I think it's one of those things where people who first get into monitoring really do enjoy the travel aspect, seeing new places. But then as you get a little older and you have already gone to a lot of these places, or you have more family commitments, or you have something where you're like, well, I'd rather be home, it gets a little more challenging. One of the things as a contract CRA that's a little different is you can decide how much allocation you want to give to a CRO. So you might be contacted and said, hey, there's a site in your area. We only want to allocate you 25% to monitor this one site, but it's a driving distance from you. So as a contract CRA, things like that become an option. So there may be an option to cut travel. That said, the opportunities aren't as common. So there are less contract CRAs out there that work with one or two sites in their local area. Usually there is an element of travel built into it. So I think that's a general overview of the pros and cons of the CRA job. As always, if there's a specific topic you'd like me to cover, please list it down in the comments and I will make a video about it. Thank you.